Moving forward to the first session, medical ethics is an applied branch of ethics which analyzes the practice of clinical medicine and related scientific research. To talk on this, we have our first speaker with us, Dr. Somnath Naskar, one of the renowned medical consultant, Associate Professor, SSKM Hospital, Kolkata. And to chair the first session, we have Dr. Professor Mousumi Basu, HOD Community Medicine, IPGMER, SSKM Hospital, Kolkata. I would like to request our chairperson, ma'am, to please come over the dais and introduce our speaker.
Hello. A very good morning to all. First of all, I am giving my sincere thanks to the organizers who have given me this opportunity. The today's first session is medical ethics, which is always important, but especially important for the current situation in West Bengal. So I know Dr. Somnath Naskar. I think he will do justice on the topic. Somnath, please.
Hello.
A very good morning to all. So this is the first session of today. At the outset, I must thank Howrah Town Diabetes Study Society for giving me this opportunity to speak on this topic. So medical ethics, which is very pertinent in today's situation, we can understand. And like the many advances in medicine have some dark past, so this has some dark past also. So this term, ethics, has been derived from the ancient Greek word ethikos, so which is taken from a root word that is ethos. So again, it has been transformed in Latin as ethica and then in French as ethic. So from that, in English, it was transformed to ethics. So this is about the evolution of the word ethics. Now, what exactly it is? What does it mean? So, is it the feelings? Is it religion? Is it abiding by the laws? Is it following culturally accepted norms? Or is it science? So, the answer is precisely no. So, what exactly is ethics? So, it's a moral code of conduct which is based on the consensus on the professional opinions. So, it's different from morality, religion, and law. So, morality is based on consensus on social opinion, while ethics is consensus based on professional opinion, and religion is dogma based on faith, while law is consensus based upon legislation. And this is fairly new concept, compared to others. So the milestones in evolution in bioethics, so some code of conduct was given in Charak Samhita, some in Hippocratic Oath. So there are some guiding principles, but exactly ethics was not there. So it was said by Celsius that it is not cruel to inflict on a few criminal sufferings which may benefit multitudes of innocent people through all centuries. So this was the concept at that time. So this is considered to be the first clinical research this is a famous thing by Dr. Edward Jenner. He inoculated the pustules, inoculation from the pustules of cowpox on a little boy without having the formal informed consent. And the reaction to Jenner, it was again a famous painting by English satirist James Gilray, and there was severe apprehension that with the use of this there may be severe side effects like cows emerging from various parts of the body. Now it's said that everything is fair in love and war, but actually it's not. So the unethical or horrifying medical experiment was, it's picked during the Second World War itself on both sides of the Atlantic. So I'll just brush you through certain scenario in that period. One is the Nazi experiment on the prisoners of war. It was between 1942 to 1945, and there was approximately, the official document said there was 15,754 victims, though it is said that originally it was much more. And a quarter of them were killed. So this is one of the infamous Nazi experiment on this was a freezing experiment. So they thought that the German army was cannot accustomed with they are not accustomed with the cold environment. So there was some experiment with the cold environment. So the victims were made to stand outside in a freezing temperature environment naked. They screamed in agony, and then they were rewarmed. So again, that was a very cruel process by throwing them in boiling water or with some sexual arousal. And there was 360 to 400 experiments with around 280 to 300 victims. And so we can jolly well understand that many victims were used for multiple experiments, and most of them were killed during the process. This was another experiment, high altitude experiment. So for the Air Force people. So they simulated the atmosphere by low pressure chamber. So they simulated the environment of 68,000 feet, the pressure at that altitude. And there were 200 people were used, and 80 of them died at that time only. And who survived, again it was said that doctor, that Sigmund Rascher, he done vivisection on their brain. So eventually most of them died. This is another experiment on children with the effect of starvation. And the shocking thing is that the end point of all these experiments was death. So till death, they were passing through some sort of experiments. So by this, there were the Nuremberg trial, which was in 1946, and there the physicians who did this experiment, they defended themselves by saying that it was same like collateral damage which was there with the bombing by Allied front. So milestones in evolution, in 1897 there was Code of Medical Ethics by American Medical Association, and the Nuremberg Code, the code that came in 1947. And in Nuremberg Code, it was made mandatory that informed consent should be there. Now this was another infamous study, that is Willowbrook hepatitis study, and this was conducted in Willowbrook State School. The study participants were chosen from there. They were the children with mental disability. They were given a milkshake laced with hepatitis virus and also injected to see the effect of, and ironically the parents were said that the study was done to prevent hepatitis. So it was not. So no full disclosure, actually false disclosure, indirect coercion, and the vulnerable subjects were chosen. This is another infamous study. This was in US. So in Tuskegee syphilis study, it was done from 1932 to 1972, 40 years follow-up of the natural course of syphilis. They were untreated black men, around 600 black men were used, they were involved they were recruited in the study and followed for 40 years. And alarmingly, the end results were 28 deaths, 100 cases of disability, and 19 cases of congenital syphilis. So again, vulnerable subjects were used, lack of informed consent, no benefits to the subjects, and deception by withholding the information. Now this was the whistleblowing article published in the New York Times, and after that in 1997, the then President of US, Bill Clinton, he apologized to one of this Tuskegee victim, who was Herman Shaw of 94 years old. Declaration of Helsinki, adopted by 18th World Medical Assembly in the year 1964. There were it was revised 7 times, and the most recent one is in 2013. And the Article 13 says that there should be a study protocol and there should be ethics committee. Now, concerns in bioethics, there is patient's rights vis-a-vis physician's privilege regarding negligence and malpractice. Now, there are certain controversy in ethics at the beginning and end of the life, like genetic engineering and cloning, like euthanasia. Biomedical research ethics. So, there are some concerns regarding role of sponsors, investigator, subject, regulator. Informed consent should always be there, and compensation for trial related injury. Now, the basic tenets of bioethics, there should be autonomy. They should voluntarily be involved in this and can withdraw from the study at any time. There should be beneficence for the study subjects. It should be beneficial, and non-maleficence. This is very important. So, do no harm. There should be no harm for the study subjects, and justice. So, these are the 4 principles or key components of bioethics. Now, something about publication ethics. So, ethics review or breach of confidentiality, there should not be any breach of confidentiality. There should be IEC board. It should be presented before any study. It should be passed through the institutional ethics committee. Now, fabrication and falsification using of false data, I'll describe it. There should be some authorship criteria. So, anyone cannot be the author of any article. So, like ghost author or something. So, they should have a significant intellectual contribution for any research. Plagiarism, if people use other people's work, claiming it as his own, or can use, if a person use some portion of one's research without adequate referencing, and again if it is referenced also, it should not be word-to-word copy-paste. So, ethics related to submission. So, there should not be simultaneous submission. We cannot submit one article to multiple journals at a time, and there should not be any conflict of interest regarding funding or other thing. So, if the research results not generated from the study, so then it's called falsification, or if it is generated by manipulating data, this is called fabrication. Like a final year postgraduate student came to the faculty requesting to analyze his thesis data. He also asked if I could make some significant results, though they weren't. So, frequently people come and say that though it's not coming significant, so just manipulate it and make it something significant. So, this is called falsification, though there is, it's not statistically significant, but it has to be made like that. So, this is called falsification. And when it was asked that how the data was collected, he said that it was taken from a senior's thesis. The data was taken. It happens like that, or the person can generate the data from their own and say that, make some kind of association or something like that. So, this is called fabrication. So, these are all serious ethical misconduct. Now, the Indian scenario, the research ethics, it's a comparatively new discipline. It's absent in the curriculum, and the ethics committee is absent in many, many situations, and maybe rudimentary in some institutes. Informed consent is a very important issue. So, there should be, the participants should be informed adequately. So, there are 2 parts. One is patient information sheet. So, all the process of the study, the possible harm or possible benefits, everything has to be informed to the participants. And after that, the participant can give the informed consent, can agree with the thing. And even if the person agrees with the study protocol that yes, I am ready to enroll myself for the study, but it doesn't mean that he has to stay there for the entire period of the study. At any time of the study, he can voluntarily withdraw from the study. And poor awareness among the scientists, journalists. Now, existing national guidelines like MCI Code of Medical Ethics, ICMR policy statement, revised ICMR guidelines in 2006, 2017, and good clinical practice guidelines. So, the expectations are all institutions in the country which carry out any form of biomedical research involving human beings should follow ICMR guidelines in letter and spirit to protect safety and well-being of all individuals. So, at the end, with the great poet Rabindranath Tagore, it said that Boshanto tumi eshecho hethaয় বুঝি হলো পথ ভুল এলে যদি তবে জীর্ণ শাখায় একটি ফুটাও ফুল. So in this cruel world, so it can the ethics, bioethics can be like an oasis in the desert. So thank you. Thank you.
Hello. Thank you, Somnath, for your specific to the point presentation. আমি দুটো তিনটে কথা বলবো স্যার. দুটো কথা, একটা হচ্ছে এথিক্যাল ডায়ালেমা আর একটা হচ্ছে এথিক্যাল ফ্যালাসিস. এথিক্যাল ডায়ালেমা আমরা মাঝে মাঝে সম্মুখীন হই. যখন আমি ইন্টারভিউ নিতে যাই, আমার কাছে আমার বন্ধু ফোন করলো যে আমার ছেলে ইন্টারভিউটা দেবে, একটু দেখিস. কিন্তু আমি দেখলাম তার থেকে যোগ্য একজন রয়েছে, তো সেখানে আমাকে চুজ করতে হবে যে আমি কোনটাকে নেব. তখন আমি ডায়ালেমায় পড়ে যাই, সেটাকে বলে এথিক্যাল ডায়ালেমা. আরেকটা এথিক্যাল ফ্যালাসি হচ্ছে যখন আমাদের আনএথিক্যাল বিহেভিয়ার আমরা এক্সপ্লেন করি এথিক্যাল. আমি আনএথিক্যাল কাজ করেছি, কিন্তু সেটাকে আমি এক্সপ্লেন করছি যে আমি তো কারোর ক্ষতি করিনি, আমি তো নিয়ম ভাঙিনি, বা আগেও তো এই কাজটা হয়েছে, কিন্তু আমার বিহেভিয়ারটা আনএথিক্যাল. সো এই দুটো আমার মনে রাখা, মানে মনে হয় সবারই জানা দরকার. আর আরেকটা যেটা সোমনাথ বলল যে বাইরের স্টাডিগুলো বলেছে নাজি বা এটা, কিন্তু ইন্ডিয়াতে একটা ভালো আছে, ভূপাল গ্যাস ট্র্যাজেডি. এটা কিন্তু আমাদের এথিক্স ফলো করা হয়নি বলে এই ট্র্যাজেডিটা হয়েছিল. আর লাস্ট আমি শেষ করতে চাই, ABCDE অফ এথিক্স. A is autonomy, he has already told. B is beneficence. C confidentiality. D is do no harm, and E is equity or justice. Thank you, sir.
Thank you.
Thank you so much, ma'am. Thank you, sir, for such a wonderful session. It's time to felicitate our chairperson, ma'am. I'd like to request Dr. S.K. Somani to please felicitate our chairperson on behalf of Howrah Diabetic Society. Thank you, sir. Thank you, ma'am.